Thank you so much for listening to this episode of Earrings Off. We want to invite you to subscribe, rate, and leave us a review. You can find us on Facebook at Earrings Off Podcast and on Instagram at The Earrings Off Podcast.
Welcome to Earrings Off. I'm Lou.
And I'm Teresa. Let's get started.
Okay, Teresa, how are you feeling about all of this news from the CDC and the coming news from the governor in our state who's saying that effective May 28th, no need for masks for fully vaccinated people indoors or out, except in some situations, I think like on planes, public transportation, and no need for social distancing. And I think they're gonna, not cap attendance in or the number of people in when you're in restaurants and other buildings. Whoa, it's a lot. What are you thinking?
That girl. I first of all, I hadn't heard that the governor spoke on it, but when I heard the recommendations from the CDC, it just is shocking. I'm so disappointed. That's an organization that being interested in health and wellness and just all things disease and how to control them, I gave them a lot of, I would go to that website often. Not even prior to this pandemic, it was just an organization that I looked up to for information.
Okay.
But since this pandemic, they have bumbled this whole thing so much so that I just have lost I've just lost something for them because, that news that came out yesterday just doesn't make sense. It really doesn't make sense. This whole thing and the decision to go maskless for fully vaccinated, because the vaccine doesn't prevent you from getting the virus, first of all. And that's the message that they're sending. Well, it doesn't prevent you from getting it.
Well, wait a minute, Teresa. Let's back up a little bit, because now I get it what you're saying about the CDC, but now when Trump was the president, we know what happened with the CDC, that he basically was in control and not allowing them to present and not present the scientific evidence for us to to act accordingly. So that was the problem with that. But now I just want to say, I get what you're saying, but the child in me, I'm like, woo woo, thank you, Lord, and we're done with it. I got excited about the news because
it makes no sense.
But
it makes no sense, Lou.
Yeah. Okay.
Even we talked about the fact that how did we ever not get to, because of all the germs and that are in the air, we
Teresa,
were surprised at the beginning that this had never happened before. It doesn't just go away like that. I feel like people are going to relax so much so.
But Teresa, isn't what they're saying though, is that fully vaccinated, you may get it, but chances are you may be asymptomatic. You probably most likely won't have to be hospitalized or die from it. So that's why they feel like they can lessen these restrictions.
They didn't say that.
What?
They did not say that. You didn't hear that, did you?
I thought I did, Teresa. I thought that's what I got.
Heard, no, what you heard, that's what you got, because see, you're doing some analysis of your brain, but that's not the
that's
message.
where she tries to tell me I don't know what I'm talking about, people. But you know what? I ain't mad at her. She thinks she's the pro. Go ahead on, Teresa. That's what I heard. What's the lady? The director of the CDC, Rachel Walensky.
No,
I thought
she did not
I was
say
watching
that.
Rachel Maddow the other night. I thought what she was saying was just what I said, that you most likely won't suffer severe symptoms were you to get it. No, that's not it.
Listen at that wording. Most likely won't. Listen at that. Are you willing to risk it on a most likely won't?
Well, I'm risking it by the fact that I took that vaccine. So there's risk everywhere, Teresa, that I put that in my body.
But you took that. You took it, right? You took the vaccine. I took the vaccine. We took the vaccine.
Yes.
but we're still wearing a mask
Well, yeah.
because we know that the vaccine is not 100%. First of
Right.
all,
Yeah.
and severe illness, it's not 100%. You can still get the virus, and
Well,
nobody says that.
right. Well,
And
and this is what I
now
want to say.
some guy, I can't remember who it was, but somebody who is famous, some famous person, and they're calling it
Yeah, yeah,
breakthrough virus.
yeah. I did get that
They keep
term
coming
right.
up with these terms, but you know
But
what that means? They got sick and they're in the hospital because
but
they got
Teresa,
COVID, but they were
well,
fully vaccinated.
and I don't want anybody to misunderstand what I'm saying because I'm still going to wear my mask. People can do what they can put up whatever
I
signs
am
they want.
too.
They can lift restrictions, but as for me, I will be wearing my mask, and I'm still not going back to the hugging and touching. And I mean no offense. Don't come near me. I will be observing all of that. So yeah, yeah.
Yeah, but they're telling you that, and see, that's the thing. They're telling us, and I think it's too soon, too much, too fast. And, I hope that we don't get ourselves in trouble,
Yeah,
like some of these other countries,
yeah,
and
India.
find
Oh my
ourselves
goodness.
right
Yeah,
back.
yeah.
It's awful what's happening to those people, to
Well,
that
Teresa,
country. It's just,
and you're right though, because Teresa, but the thing is, the majority of Americans still aren't vaccinated. So
okay,
there's
I'm glad you said that, because here I go with another one. This is a conspiracy theory of my own making. So the
here we go.
the
Here we go.
the bulk of the Americans aren't. So we had that mad rush to get 1 million or 2 million. I can't remember the number a day. We met that. We exceeded that. And now the people who wanted to get vaccinated, they stood in those lines to get those vaccinations, right? And now we have this overabundance of vaccines that they're having sitting in warehouses, and we have no one to give them to, because everybody who wants it has received it, right?
Right.
Except for children, right? Because they couldn't at the time. And now here we go with all of these incentives. If, like Ohio, they're creating a lotto, $5 million. If you get the vaccine, your name's going to go in a pot to win
Oh, I
$1 million.
heard
They're
about
giving
that.
away
Okay.
$4 million, $1 million a week in the month of May to adults. For children, they're giving them a chance at full ride scholarship to the college of their choice in the state of Ohio, right? So they're giving that. You got restaurants who are giving donuts for life, or a
Mm,
year, or
mm.
French fries for life or a year. You know
That's what
what?
happened to me. But
That
go on.
is so insulting to me. That is so insulting. And the fact of the matter is that, when you go to places like, if you go to rural places or urban places in Ohio or any other state in the country, they don't have access to the vaccine. It's not a matter of them not taking it. The vaccine isn't where they are. And giving these incentives is just absolutely insulting. And I think the CDC is acting on that. They're just trying to say, okay, well, look what you get to do if you get the vaccine. You get to take your mask off. How insulting. Really? They think we're that stupid? That's what my problem is with these announcements, with the incentives to
Okay,
get
let me
to get
unpack this
vaccines.
because
I'm just totally.
I wasn't following. So you are insulted because you're saying in some neighborhoods they can't get access to the vaccine still?
Well, there are still not only just they have what you call pharmacy deserts in Chicago, where people have to catch a bus and walk many miles just to get to a pharmacy, right? They can't get the vaccine, but they don't have the transportation. They can't get to the places where the vaccines are being distributed. They're not bringing the vaccine to them. This was a news story that I actually saw,
Mhm.
where there are places in Texas, rural Texas, where they only have a clinic. They don't even have hospitals. They have to drive 4 hours just to get to a place where there's a hospital. So these folks don't have access. They can't afford to go to these
And see,
places to get to get the vaccine. There are still people in this country who don't have access to a vaccine. So yes, it is
Yeah,
insulting for them to put
I get
forth
that.
a comment like, "Oh, they're trying to say that people aren't getting it because they're just choosing not to." Well, some people don't even have access to,
And see,
right? They're
what
not
I've
talking
been
about that.
reading is that they've had so many of the mobile clinics, and that they're doing a better job in getting the vaccines to people. That all kinds of transportation has been arranged for people to get to the clinic. So, but I hear
So
what
where
you're
are those
saying.
neighborhoods?
Yeah, yeah. Actually, I've heard about some
Yeah.
in different cities that have been challenged, but I get what you're saying. But I'm not, I understand what you're saying about there is an equal access, but I'm not offended by them offering incentives, whatever they need to do
Oh
to get
yeah.
people to get vaccinated. I'm not offended by it.
But Lou, it's not about that. It's about the people are worried about the safety of the vaccine. That's
Oh
where
yeah.
I was.
Oh
I
yeah.
mean, that's why I
So was
mean,
I.
and that's where
And
I
that's
still
where I
am.
still
So
am.
it's
Yeah. Yeah.
that's
I'm still there.
but so
Yeah.
that's why I'm offended that yeah, I'm offended. You're gonna give me a donut if I get the vaccine? No. I mean, that's what's offensive to me.
Oh, I
No,
see what you're
don't
saying. But
offer
see,
me
yeah. But
yeah.
see, Teresa,
Tell
I
me
didn't do
and
that.
assure me that it's safe.
I didn't do that, but I
That's
didn't
what
get
that's what
the
I've
vaccine. Yeah, I didn't get the vaccine for any kind of incentive. I got it because I thought it was the best decision I can make for my health and well-being, and no amount of money that they print, anything that they give is going to replace that. That was a hard, hard decision. But going back to the
eh,
lifting of the restrictions, it's a lot to digest. I was elated when I heard it, but also nervous at the same time, because I don't know if I trust that. I don't know what it's going to mean for us as a country if we rush to take off these masks and let up on the sanitation protocol and the social distancing. And particularly when what I thought about is the fact that you're mingling with children who may likely be asymptomatic and they can't get the vaccine yet. And so, what does that do for the general population with encouraging all of this lifting of the restrictions? So, but I also found it odd that they're saying, but on public transportation, on flights, you absolutely still must wear the mask.
mixed
So, what
message.
does that make?
That's another
What's
problem I have with
different
the
about
CDC.
that? Is it the ventilation? Is it the number of people? Is it the air that there's so many people cycling through? I don't know, but that concerns me. I want to understand. Okay, how is that?
No difference.
Yeah, right, right.
It's a mixed message, which is what the CDC has done this entire time. It's mixed messages. They're not being responsible in their message. They're not. That's another thing that's insulting. They don't think we can process and think this through ourselves. That it just doesn't make sense. It doesn't add up. Just like when they told us in the beginning that we didn't need masks. I'm like,
Yeah, but that was
we're
the Trump
watching Wuhan
administration.
on the news, and
Yeah.
every person that we see had on a mask, and they were in that was ground zero. So they're
Yeah.
gonna tell us we don't. So yeah, it's very
So,
disappointing, and I hate to
so,
sound so
but
so
Teresa,
angry, but I am
in light
about
of
the whole thing.
the recent lifting of restrictions, then what do you plan to do individually? Are you planning to make changes to what you do now?
No,
No. Okay.
I'm going to
Neither am
continue
I.
to wear a mask.
Yeah.
I've been vaccinated. I'm going to continue to wear a mask. And because I can still get it. And I
Yeah.
hope everybody realizes that you can still get it. You don't know how your individual body is
Well, that's
going to
true.
respond. And
Well,
unless
yeah.
you're willing to take that risk, then
Yeah. Yeah.
you
Well, and I tell you,
you know,
I just had a conversation with my with Nasheed earlier, because we were planning on I'm actually going to schedule a trip to go visit my sister's grave. my sister that died
Yeah.
from COVID. And because that was the first thing I wanted to do when they lifted these restrictions. So I'm going home. And when we were planning on going, I said, well, maybe we can, stay with the family member. He said, we're not staying with any, we're not going to anybody's house. He said, Lou, they probably don't want us in there and we don't want to be there. And I thought, okay, so yeah, we just won't do that yet. He said, we're not going to be encouraging all of this closeness just yet. And so he was right,
Well, see, that is a very reasonable response. My fear is that others won't process, and maybe that's insulting for me to think that. But my mom took a very dear friend of hers to the doctor the other day. Well, she has a really good friend that's been really sick that she's been transporting to and from the doctor for a while now, throughout 2020.
Really?
And
Oh,
even this
wow.
year. And
Wow.
so the doctor knows my mom, and this woman has no living relative. She doesn't have any children. She's alone, and she has an ex-husband, and she has his family. It's close, still remains close to, but no living blood relative. Friend of my mom from the doctor. So the doctors know my mom, and they talk through her medical condition with my mom and her. They share, and I guess the lady has my mom as a emergency contact or something. Somehow the doctors feel comfortable enough to speak about this woman's medical condition in front of her. So this announcement from the CDC came out just this week, right? So they went and had this appointment was last week, and the doctor, female, said to my mom, she said, why do you continue to wear this mask? You've been inoculated. Why do you continue? This was a doctor who said this, my mother, in her office. And she said, what do you? And she was like, you don't need it. You shouldn't, you've had the vaccine. Why do you continue to wear a mask? That's ridiculous. That was, and I said, what was your response to her? She said, well, behind my mask, my mouth was wide open. I was just shocked to hear that coming from a medical profession in a doctor's office, and so that was so irresponsible. Then fast forward to this week, maybe she already knew that this comment was come out being this announcement that come being in the medical field, but I just find it all I don't know. I just find it all strange.
Yeah,
and irresponsible.
It's really it's confusing. You're right. And it's concerning. And I want to, you want to make the best decisions for yourself and your family. So, but like I said, as for me in my house at this point, we are still going to be, we won't be changing our behavior from the behavior we adopted during the pandemic because we're just trying to be safe. And, that's what we're trying to do. It's a lot to digest.
I'm reminded it is, and I'm reminded of a conversation we had early on about COVID-19, the fact that it politicized, and that could be part of the reason why I feel the way that I do, because I don't know if I'm being told the truth.
Teresa,
because
that's
it was
an
made so
excellent,
political.
excellent point. That's an excellent.
You know,
It's true. Because people will do
yeah,
anything to make sure that they are seen in the best light, as like you come in and you save the day and possibly put us at risk. So I get it. That's a valid point that you're saying, and it's you hate to think that something as serious as our health, the health of this country, lives being lost, would be a political issue, but we've seen how it absolutely is one, so
and so I'm just worried. I know one thing I do know, that if I protect my face with a mask and my eyes with goggles, that disease is not getting in, right? It's not. But if I don't, then it can. And so that's why I feel so strongly about the whole mask wearing thing, because we don't know, like the point you made. It's like, you're going to tell us we can take off these masks, we can gather in large groups, but when we're on an airplane or we're in a public space, we need to wear it.
Right.
Just doesn't make sense.
And Teresa, I'm listening to the news just like you, that there are still some cases where people who've been fully vaccinated have gotten COVID. My sister shared with me that there was a case in the news there of a female, I think was 44, and she died, after having received the vaccine. She got
it
COVID. So, and there probably
well,
were other
let me tell you
underlying
something.
conditions, but still, she died.
Let me tell you something. If nothing else, I want people to understand the vaccine does not prevent you from getting COVID. They don't say that in the news. I have never heard anyone say that.
Yeah.
I haven't.
Yeah.
It doesn't prevent you from getting
Yeah.
you take the shot in hopes that if you get COVID, you don't end up in the hospital and you don't get severely ill and you don't die. That is the hope. And even that's not 100%. Like you said, someone who was vaccinated died.
Yeah. There have been several cases I've seen in the news. So, folks, we're just talking about the recent update from the CDC where they are lifting some of the restrictions that we've adopted during the pandemic, and just trying to make sense of it all. So we hope that you take in the information and that you are able to make the proper assessment for yourselves as you move out and about to stay safe. So that's what we have today.
Please give it some thought and do what's best for you and your family.
And as always, here at Earrings Off, we wish you health and that you stay well. Take care.